Hello everyone, my name is Souzan El-Chazli. I'm going to present on Lyme disease. Lyme disease or borreliosis is a tick-borne infection caused by certain species of Borrelia genus, which basically is Borrelia burgdorferi in the US, a genus of facultative intracellular bacteria. The incidence, it's most commonly reported vector-borne disease in the US, and the geographical distribution primarily it's in the Northeast and the upper Midwest in the US, as you can see here in the map. The pathogen mainly it's in the US, it's Borrelia burgdorferi, an anaerobic facultative intracellular spirochete bacteria. The vector mainly, there are various tick species. Mainly it's Ixodes scapularis, which is mainly known as the deer or black-leg tick in the northeastern and the upper Midwestern in US. The high-risk groups mainly, it's the Lyme disease. They are increased risk here. It's in the outdoor workers, which basically they are mostly the landscapers and the farmers. The outdoor enthusiasts who have their like hobbies, like the hikers and the hunters. The signs and the symptoms of Lyme disease, it's mainly divided into different stages. It starts with the stage 1, mainly it's called the early localized Lyme disease. The symptoms develop within 7 to 14 days after a tick bite, and it's mainly called the erythema chromium migrans, which basically it occurs in 80% of infected individuals. Usually it's a circular, slowly expanding red ring around the bite site with a central clearing, and sometimes it's called as the red bull eye rash. Typically, it's warm and painless. Erythema migrans, it's also often the only symptom in the stage 1 after the tick bite, and it's self-limiting. Typically, it subsides within 3 to 4 weeks, and the patient only actually feel flu-like symptoms. That's all in this stage. In stage 2, it's called the early disseminated Lyme disease. The symptoms are more severe. It develops between 3 to 10 weeks after a tick bite. A first symptom that it's mainly the migratory arthralgia that can progress to Lyme arthritis, which what basically means that it means that like this it spreads from one joint to another, and generally it affects the large joints, especially the knee or the elbow. The second also symptom is the cranial nerve palsies. Most commonly, it affects the peripheral facial nerve palsy, and the patient it often get confused with Bell's palsy, which basically it's a central disease that affects also the facial nerve. It's basically paralysis of the facial nerve, as you can see here in this picture. Also, the patients can suffer from nocturnal radicular pain and also paraplegia, which means that it's sensory loss, also paralysis of the extremities. Also, there's more severe symptoms like the meningitis, which basically means the inflammation of the brain. Uh, and the other also severe symptom is the Lyme carditis, which basically it affects the heart. It's inflammation of the heart, and this increased risk of cardiac arrhythmias. For example, AV block on the ECG strip. It can also progress to rarely myopericarditis, which means the fluid-filled pericardium around the heart. In stage 3, it's a late Lyme disease. Basically, its symptoms develop months to years after the initial infection. The symptom that's most prominent is chronic Lyme arthritis. It lasts over a year and may be intermittent or persistent. Typically, it affects the large joints, which especially also the knee or the elbow, like stage 2, but it's more chronic, and it's difficult to treat. More severe symptoms like also cognitive impairment. Patients also can suffer from chronic neurological symptoms like headaches and dizziness. There also sometimes gait abnormality. The diagnosis for Lyme disease after the tick bite, you observe for erythema chronicum migrans, which are basically suspicious rashes may be monitored over several days. If you are sure that it's actually erythema migrans, and then you give the antibiotic treatment. If like you're sure that you are in stage 1 Lyme disease, empiric antibiotics should be started before further testing. If the symptoms of the Lyme disease arise in a patient with possible exposure, especially if a history of recent travel to an area with high vector density, basically what you conduct is two-step serological testing. The initial test is ELISA. Basically, it's enzyme-linked immunosorbent assay. The second test, which is the confirmatory test, which is the Western blot test. They detect the IgG and the IgM antibodies against the Borrelia. That's when you confirm it, and if they are positive, you give the antibiotic treatment. And if it's negative, then you consider other causes. If there is no rash and the symptoms of the disseminated Lyme disease doesn't develop, then it's actually Lyme disease is very unlikely, and you have to look for other causes. For the treatment for Lyme disease, it depends on the stage they are in. Early stages like stage 1 and stage 2, the milder form, it can be enough with doxycycline. But if it progresses to neurological symptoms, then the patient need to be admitted to be given IV antibiotics, mainly ceftriaxone that's given. Um, so you have to hospitalize and give the IV antibiotics. If the infection is likely, you have to start the antibiotic first before the diagnosis. Sometimes, also in pregnant women, doxycycline can never be given to them. So, because it's teratogenic, so you have to give amoxicillin instead. For prevention, there's no approved vaccine on the market. Mainly the case management and the prevention, it's avoiding the areas that's known for Lyme disease. And also prevent and properly manage the tick bites to avoid the exposure to Lyme disease. Uh, also the wearing protective cloth is very important. Example, the long sleeve shirts and the long pants. Also, wearing light colors to make the ticks visible so that they can be removed right away. Also, tucking in the cloth into the socks, pull the socks over the pant legs, and wearing shoes that cover the entire foot. Also, it's essential to use the insect repellent containing the DEET. After time outdoors, you have to check the cloth and body for ticks. Once you spot the tick, you have to remove the tick immediately. But there is a specific way to remove the ticks. You have to use a fine tip tweezer, as you can see here in the picture, firmly grasp the tick head or the mouth parts as close to the skin as possible. Also, carefully pull upward with even pressure. Never twist or crush the tick during removal. Also, never use nail polish remover, adhesives, oils, or similar substances to remove the tick. The tick should be removed quickly rather than waiting for it also to be detached slowly. And disinfecting the site of the bite and disposal of the tick, and observe the bite site for early detection for the erythema migrans, which is the red bull eye rash. Thank you so much.